Hutano developed a platform that simplifies finding healthcare providers and booking appointments. The platform also automates collecting patient data, scheduling, appointment reminders, documentation, and document sharing. Hutano makes it quick and simple to find healthcare providers in your neighborhood. Whether you're looking for a provider by name, or you need to search by specialty, or you're just looking for a specific service. Plus, our listings display all the essential information up front, like out of pocket costs and accepted insurance plans. So, if you're looking for, say, a COVID-19 test or any other healthcare service, Hutano is a perfect place to start your search. Now, imagine never having to write your date of birth again on a medical form, or your insurance information, or your social security number. It sounds like a dream come true, right? Well, on Hutano, it's reality. Hutano allows patients to enter their demographic information and their medical information only once, and then transfer it from visit to visit and healthcare provider to healthcare provider. Using Hutano, it's easier than ever to get the care you need, when and where you need it. First, find a provider. Once you found one, it's time to select how you want to receive care, in a clinic, on site, or virtually. Then select a date and time that works for you. Sign the digital consent and update your social history, allergies, and medical history. That's it. Next, all you have to do is tell Hutano why you're seeking care. Specifically, tell Hutano what hurts, how uncomfortable you are. Describe your discomfort. What makes the pain better or worse? How is the discomfort affecting your daily life? How long have you had the problem? And if you have been treated for the same condition before, where? As anyone who has ever been to a doctor's office knows, once you finally get into the exam room, the doctor often asks you many basic questions that could have easily been answered in advance. One way to improve the situation is to make sure that the providers get all the information they need before the patient arrives for an appointment. For example, photos of the condition to help make a diagnosis, copies of medical documents, which can provide valuable information about the patient's history, medication lists, also important as they can help prevent dangerous drug interactions. Finally, the most recent vitals, to give the doctor a snapshot of the patient's current health status. Having this information beforehand makes it much easier for providers to identify and treat problems, and reduce wait times and increase efficiency. With Hutano's documentation engine, clinicians can simply sit back and relax and let the engine summarize everything gathered during the virtual interview and package it into a well-written medical document. Furthermore, Hutano ensures that the patient's words are captured accurately, providing a foundation for better care. In addition, this document lays the foundation for Hutano's smart electronic medical record that transfers all this information into the provider's note, saving the provider a ton of time and effort. Now comes the final step in setting up an appointment on Hutano. After choosing the provider, the date, and the time, and completing the intake, all that is left is to specify how you will pay for the services. If your provider accepts, you can use a credit card online, insurance, or cash or check offline. That's it. In just 5 to 8 minutes, you have set up an appointment and sent all the information a provider needs to provide care. Talk about efficiency. My name is Ephraim Makube. I am a doctor specializing in physical therapy, but I am also a software engineer and I hold an MBA in healthcare. I have a team of 8 people working with me, including a CFO, a CTO, and a chief medical officer. We're all working together to build the best healthcare productivity software, and I think so far we're succeeding. Thank you.